This lecture is going to cover the introduction to the respiratory system, the definition of respiration, and the nose. Introduction. Guess what? Without the respiratory system, we could not survive. Basically, this system serves to bring oxygen into our body and remove carbon dioxide. There are two systems that work hand in hand to supply oxygen and eliminate carbon dioxide. They are the respiratory system and the cardiovascular system. The respiratory system takes the air that we breathe and provides for gas exchange, and the circulatory system transports blood containing these gases between the lungs and the body cells. Before we get into the actual organs of the respiratory system, we must define what respiration is. So if you're ready, let's go. Respiration is the overall exchange of gases between the atmosphere or environment, blood, and cells of the body. There are three subdivisions of respiration. Pulmonary ventilation, this is what we call breathing. It is the movement of air into and out of lungs, a rhythmic movement of the rib cage or thorax. It involves inspiration or inhalation and expiration or exhalation of air between the lungs and the atmosphere. External respiration is the exchange of gases between the alveoli or air sacs of the lungs and the pulmonary capillaries of the blood vascular system. Simply stated, it is the exchange between lungs and blood. It is pulmonary circulation that we learned in Anatomy 1. Internal respiration is the exchange of gases between the systemic blood capillaries and the tissue cells. This basically deals with systemic circulation that we learned in Anatomy 1. So, let's go over pulmonary circulation. We have deoxygenated blood in the right ventricle of the heart, which will then exit into the pulmonary trunk. Pulmonary trunk is going to bifurcate or divide into the right pulmonary artery and the left pulmonary artery. The right pulmonary artery will bring deoxygenated blood to the right lung, whereas the left pulmonary artery will bring deoxygenated blood to the left lung. There are capillaries that will be wrapped around the alveoli or air sacs, where the exchange for deoxygenated blood for oxygenated blood takes place. Oxygenated blood is returned to the heart through 4 pulmonary veins, and it is delivered into the left atria of the heart. The organs of the upper respiratory tract include the nose, the nasal cavity, and the pharynx or throat. The nose is the preferred entrance for outside air to enter into the respiratory system. Air may also enter through the oral cavity or mouth, especially in people who have mouth breathing habit or whose nasal passages may be temporarily obstructed, as by a cold. For our purposes, consider the mouth digestive in nature. The nose is located in the center of the face, again, the preferred entrance of the respiratory system, and it is divided into an external and internal portion. The external portion is the visible portion and consists of a supporting framework of bone, which are the nasal bones. It's composed of cartilage and is covered with muscle and skin and lined with the mucous membrane. The internal portion is located in the anterior aspect of the skull and lies inferior to the nasal bones and superior to the mouth. The nasal cavity is located in the internal portion. It is also lined with the mucous membrane, which contain hair or cilia that trap large airborne particles. The nasal septum is a vertical partition located between the two nasal cavities and is composed of bone and cartilage. It too is covered with the mucous membrane. It divides the nasal cavity into a right and left portion. Do you remember what forms the nasal septum? The perpendicular plate of the ethmoid bone forms the superior portion. The inferior and posterior portion is formed by the vomer, and the remainder is comprised of septal cartilage. Sinuses, also known as paranasal sinuses, are air-filled cavities that open into the nasal cavities. All of the sinuses are lined with ciliated mucous membranes that is continuous with the nasal cavities. Do you remember what the sinuses are? You have the frontal, ethmoidal, maxillary, and sphenoidal sinuses. Nasal concha, or turbinates, are 3 paired scroll-like bones The superior and middle nasal concha or turbinates are processes of the ethmoid bone. The inferior nasal concha or turbinate is an independent facial bone. The posterior or internal nares or choanae are the openings between the nasal cavity and the nasopharynx. This is how air gets into the nasopharynx. The functions of the nose is that it's going to warm incoming air via nasal concha or your turbinates. It moistens air by way of the mucous membranes, filters air through the cilia, and olfactory stimuli for the sense of smell by the olfactory foramina that is located in the cribriform plate of the ethmoid bone.